Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. The following structure limits rotatory movements of the brain within the skull. A. Tentorium cerebelli. B. Diaphragma cellae. C. Falx cerebri. D. Dorsum cellae. The correct answer is C. Falx cerebelli. This limits the rotatory movements of the brain within the skull. Which shoulder joint is typically associated with a positive step deformity? A. Sternoclavicular joint. B. Acromioclavicular joint. C. Scapulothoracic joint. D. Glenohumeral joint. The correct answer is B. Acromioclavicular joint. AC joint dislocation results in positive step deformity. With the rupture of acromioclavicular and coracoclavicular ligaments, the distal clavicle moves superiorly. This leads to this deformity. A college student reports shoulder pain that started a week after final exams. Examination reveals scapula winging on the dominant side and patient struggles with elevation beyond 120 degrees. Although scapular elevation is normal, what is the most likely differential diagnosis? A. Accessory nerve lesion. B. Long thoracic nerve lesion. C. Shoulder impingement. D. Acute rotator cuff tendinitis. The correct answer is B. Long thoracic nerve lesion. This long thoracic nerve innervates the serratus anterior, which is the scapular stabilizer. The nerve can be compressed with backpack strap as it lies along the chest wall. This patient will have scapular winging but good scapular elevation strength. Damage to the spinal accessory nerve will inhibit elevation of the scapula. A physical therapist is treating a patient with left-sided C4 facet impingement and plans to use manual cervical traction to open the left facet. In which position of the cervical spine would the left facet be maximally opened? A. Flexion, left side bending, left rotation. B. Flexion, left side bending, right rotation. C. Flexion, right side bending, left rotation. D. Flexion, right side bending, right rotation. The correct answer is C. Flexion, right side bending, left rotation. Contralateral bending and ipsilateral rotation is the best position to open up the facet joint of the cervical region. I hope this video would have been useful. For more such videos, stay tuned to our channel. Thank you.